Dr. Albert Schweitzer has long been admired as a medical missionary and humanitarian. That spirit is kept alive through the work of the Albert Schweitzer Fellowship program in the Boston area with students pursuing careers in healthcare. At its fundraiser October 27th, the fellowship will present awards for humanitarianism, health promotion, and service. To tell us more about the fellowship is the program director for the Boston chapter, Karen Spiller. Also joining us is a former Schweitzer Fellow, Iman Berrahou. Thank you both very much for being with us.
Thank you.
I want to start with Karen Spiller. Beyond what was briefly said about Albert Schweitzer, what is the mission of the fellowship?
The mission of the fellowship is really to develop leaders, and we say develop leaders, but it really is to evolve them to be connected to the community, to be engaged with community. Oftentimes when we do our medical work, we're housed in research. So the fellowship allows you to take your research to practice and really make connections in terms of, we call it humane and humanitarian types of ways. And it's really for some, the first time they've gotten out of the classroom, off the campus to do that. One of the things I always like to lift up about the fellowship is that traditionally a fellowship is one that you see an application and it has a list of things that you're expected to do and report to XYZ person. But the Albert Schweitzer Fellowship is designed for fellows like Iman to come with something that's really deep in their heart in terms of a disparity they're concerned about, an issue of health. They want to use their current experience or develop a new experience around it. And they apply with that idea, but they also have to seek out a community-based organization. So they're really actually building networks before they even get into the fellowship. And so with that, we end up with an array of amazing young people. Iman's a physician in training, but some are dentists, they're in nursing, law, social work. So we look at the interdisciplinary piece about health and healthcare. And for many of the fellows, it's the first time they've been in a space for a period of time with someone outside of their medical school classroom or their schools. So most of our projects and programs are from different schools. So we have multiple schools. We have Harvard School of Public Health. We have BU. We have Tufts, Mass General, interprofessional health professions. So really that real whole health, whole experience that they have through the Albert Schweitzer Fellowship.
Ron, tell us about your experience in putting that research into practice.
Yeah, absolutely. So really the Schweitzer Fellowship, as Karen mentioned, is the opportunity for us to sort of practice our passions in sort of real time and real life, for some for the first time. So for me, what I did was I decided to make a film project all about exploring how LGBTQ people access cervical cancer screening. So what we did was really we just went out into the community and found people who were willing to talk to us about things that they had gone through, challenges that they had faced in accessing care that was competent and sort of affirming for them. And we had providers speak about the care that they give to LGBTQ patient populations and sort of put that film out there both for clinicians to learn from and for community members to access as a resource when they think about going to the doctor to access really this vital preventative health measure.
What did you learn from the LGBT people you were talking to?
Well, we learned a lot. We learned a lot of practical information. So we learned about things that physicians can do really immediately in sort of initial conversations with their patients to improve the experience. We learned a lot about specific challenges to each unique sort of subset of the LGBTQ community, because obviously not every single person is the same, and people differ a lot in their gender identity experiences and in their sexual orientation and how that sort of plays out in a doctor's office. So we learned a lot about people and how they experience health and how physicians can help to make that experience better.
Of course, I imagine even before this, there must have been an idea in your head, maybe some indicator that there was a problem out there that you had to fix. How did that work out?
Yeah, absolutely. So for me, a lot of it came from actual patient interactions that I saw in clinic. As a third-year medical student, it's sort of our first time getting in there and learning from patients and interacting with patients. And so I saw sort of firsthand some of the challenging conversations that were being had around cervical cancer screening and accessing that for LGBTQ people. And so I had in my mind that this was something that I might want to pursue, and was able to find community resources and a wonderful mentor and some collaborators to really help me carry it through, and a wonderful fellowship to support me in it.
This is BNN News. We're talking with Karen Spiller and Iman Berrahou from the Albert Schweitzer Fellowship. Karen, the person who's being honored with the Humanitarian Award is a physician in Michigan, right around the Flint, Michigan area, with all the problems with lead in the water. And one of the things she's being recognized for, she got a tip from somebody at the EPA and decided to do some research on children.
Well, she was doing the research, but just by being in that space, that hospital, the Hurley Hospital, patients were coming and saying they were concerned about the water. And she just said, let me do something about it. So it's both and in terms of that. And Flint, you read about it. Flint is the fourth largest metropolitan area in Michigan, the seventh largest city. But it's also, because of the auto industry and the decline, one of those that's been very impoverished. Education, income, access. And as Rashika would talk about Mona, and everyone talks about the lack of food, grocery store. So it was really one of those, I would say she saw a disparity, and that was already magnified, amplified by what was happening, and stepped in. And so when we think about a humanitarian, it's one that sees an issue, uses their power and their skill and their privilege to be able to shift.
Well, in Flint, the medical board is on the environmental, but also the political. She got some pushback politically in what she was doing, right?
Of course, because it was a decision to shift from the Detroit water to the Flint water, and that was an economic decision, and it was pushback for lifting that up. She'll be talking more about that during the conference that we have over the weekend. But it was one of those courageous things to step up and say, this is not right. And usually, again, that's what we always think about in terms of the role of fellows. She's a fellow for life, just as Iman is now, and demonstrating that when you have experiences of really being connected to community, there are things that you just can't turn your back on, no matter how difficult, how much you get as you said, pushback. One who's looking to shift and change that disparity looks, we move the boulders. We talk about boulders are those things and barriers that get in the way. We identify them, hit them head on, and move forward. So that's why we're so really grateful that she accepted such an award, but really want to lift up that courage.
Iman, in addition to awards and fundraising tomorrow, there's going to be some panel discussion. You're going to be involved in that, so what are you going to be doing?
I am. So I'm going to be talking, actually, much as we're talking about now, sort of my narrative experience about what it was like to work in the LGBTQ community, and specifically talking about community engagement that I experienced as a fellow. And I'll be joined by Dr. Sean Cahill, who's going to give sort of a similar talk about policy and advocacy through policy research, and how those things together form a really wonderful platform to sort of improve the access that LGBTQ people have to competent, affirming care. So that's the goal of the panel.
Thank you both very much for being with us. Karen Spiller and Iman Berrahou from the Albert Schweitzer Fellowship.